QIS by EHR Integration Services. Quality Information Systems is an Allscripts Enterprise EHR add-on solution that helps healthcare providers meet requirements for today's ever-changing mandates on chronic disease care and prevention. Within Enterprise, a traffic signal designates how well the patient's active problems are being managed. When a user is logged into Enterprise and a patient is in context, the traffic signal appears. Based on the color of the traffic signal, the user can determine if the patient has any tracked measures that are not being met. A red traffic signal would indicate that there are more than 4 quality items needing attention. Yellow would indicate that 1 to 4 quality items need to be completed. And finally, a green traffic signal would indicate that for all patients' active problems being tracked by QIS, the measures are up to date. QIS only recognizes problems that are within the patient's active problem list within Enterprise. Don has a yellow traffic signal indicating that there are measures that need attention. On his problem list, I can see that he has diabetes, hypertension, and colon cancer. To determine the exact measures that he is not meeting, I can click on the traffic signal to display the QIS dashboard. The QIS dashboard will show me all of the items being measured for the problem that is listed in the QIS problem dropdown. This dashboard visually indicates with red highlighting in font that the A1C, LDL, and microalbumin are all needing attention. If I click on the QIS problem dropdown, I can see all the problems being tracked by QIS, but the dropdown only shows the items that the patient has within their problem list. The same color scheme concept is implemented into the dropdown. This allows a user to quickly determine that the patient is up to date on their hypertension due to the green font. Selecting the different problems in the dropdown will display the assigned measures associated with that problem. Not all users need to track each population of patients set up within QIS. Therefore, QIS gives the user preferences to control which problems affect their QIS traffic signal. In this instance, the user is concerned with all problems listed above the preferred lists line. The system is also picking up on the patient's colon cancer. This is included in the dropdown as an FYI to the user, and they are still able to view the measures associated with it. Preventative care measures can also be tracked. This can be set up by age and track several items such as mammograms, flu vaccines, documentation of smoking status, and much more. For each measure, QIS has the capability to track discrete data elements from Enterprise. Such items would be anything from the OID dictionary, all of the problems except family history, as well as document types. While QIS gathers all of its data from the Works database, it also utilizes the stored procedures of Enterprise, allowing the user to efficiently update a measure within 3 to 4 clicks. The data entered through QIS directly populates Enterprise as discrete data elements. By clicking the Update button for colonoscopy, I can document the completion date of the procedure, enter a comment or result as desired, adjust the performing location if needed, click Insert. The entered information now shows in QIS. It also immediately shows within Enterprise. All QIS measures can be updated except documents and medications. Another way to view this information is via the Patient Report tab. The Patient Report shows all problems and measures within one page and allows printing. QIS also provides organizations with built-in reports to take chronic disease management to another level. These are accessed by clicking on the User tab. To view a report, first select a provider. The Reports dropdown contains several reports that can be utilized in managing chronic disease populations. For each provider, QIS supplies a problem report for each patient population being tracked, or a complete problem report which would encompass all QIS problems and measures for the selected provider. As an example, if we run the hypertension report for Dr. Feelgood, it provides a list of all Dr. Feelgood's hypertension patients, their demographics, and how they are doing for each measure corresponding to hypertension. Another powerful report is the metric report. It allows date, problem, and QIS problem filtering. This report is ideal for the administrative teams to examine the organization's disease management at both a high level and down to the patient level if needed. For example, I can see that for diabetes, our organization has 2 patients, both managed by Dr. Feelgood. Clicking on the numbers in the patient column provides a patient drill down for details on the 2 patients. Let's click the back button to look further at the metric report. The metric report also analyzes exactly how the organization is doing overall as laid out in the dark gray line. In the last column, it also shows how each provider is doing compared to their peers within the same specialty. This allows healthcare staff to accomplish disease management and preventative care for each patient with little research and staff education. As shown in the demonstration, QIS is a key partner for healthcare teams to ensure they are seamlessly tracking and meeting today's requirements.